we'd go to the local live bird market. This is a true story. Live bird market in Kampala, Kenya, Uganda, and we'd say, do you have any sick birds? And the guy, oh, no, these aren't sick birds. They're all fine. No, we want sick birds. And he goes, oh, they're all sick. That's exactly what the guy said. And he was right. So thank you. My talk today has kind of like two themes. I have a little struggle trying to integrate them. But one is basically that how important poultry is for development. And the other is how important One Health is to do poultry projects right. And so I'm going to, get this thing going here. So this is what I'm going to go over, and hopefully it'll be 40 minutes, and then we have some questions. But I'm going to talk briefly about why poultry is so important in its potential in developing countries. I'm going to talk about the challenges of trying to improve poultry in developing countries. Then talk just a little bit about strategies of intervention and kind of principles of strategies of intervention. And then I'm going to talk about a case study in Nepal that's currently underway. It's called the Suahara program. It's a major USAID funded program, covers about half of Nepal, and it has a very focused goal of improving child and mother nutrition and health. And then I'm going to basically talk about how that project would probably be a lot smoother, although if it started with kind of a One Health approach from the start. And although essentially it is a One Health program, you'll discover as I talk about it later, I don't think it was done that way so much by design originally, but you'll see why I think One Health is very important for that, and for doing essentially any poultry project. So I'm going to just go through a couple quick slides. I'm not assuming you've all been in the developing countries and looking at chickens. It's just a couple quick slides to give you a sense of the environment. So it doesn't matter whether you're in Latin America, whether you're in Asia, or whether you're in Africa, chickens and poultry are ubiquitous. You'll see almost little household will have 2 or 3 chickens. In Latin America, this is Nepal. The other point is that pretty much children and women are the primary caregivers for poultry, typically. Not always, but typically. And and what you'll see is what you call village chicken. I'll use words interchangeably, but village chicken, local chicken, household chicken. In the nutrition world, they like to call it homestead chicken production. But what I have focused on, I don't work on commercial chicken production. All my work is focused on kind of village level chicken production. How do you take a farmer with 5 hens to 20 hens? And basically change their life by doing that. Well, I'll show you why in a few minutes. But this is upper Nepal, and this here is in Kenya, and pretty much this is a Maasai woman at the bottom. Is raising those the birds at the bottom. These are rice growers, but they also in the Terai at Nepal above, but they also raise poultry. And then one of the really important things about this system, which I'll call a scavenging poultry system, which is what you see around in developing countries, is that for the most part the chickens go find most of their own food. And that's what actually makes it a sustainable system we call a low input system. For example, on the lower left slide here, where you have livestock, it's a great place for chickens to forage. And then they're sold in various ways. Sometimes there's middlemen that come through the little village on a bicycle and they buy eggs. Sometimes you'll just go to a local little live bird market, but you'll have guys like these guys who probably in the morning went to some villages, collected eggs, collected birds, and then they go to the roadside and sell them. Or they're sitting there waiting for a truck to pick them up, like the guy on the right, and take it to the nearest city. And so these are local chickens going to market. So just a little background on chicken and why I think it's so important. So this is what I see when I walk into a village. I see dollar signs and micronutrients running around the ground. It's not what most people see, but this is what I see. And actually, even when you talk to local people, it takes a while for them to understand really that's what's running around the ground. So let's talk about why it's so important. So if you go across sub-Saharan Africa, for example, and that's where most of my experience is from, so most of this is a reference to that, 10 to 30% of the woman's income in an African village is from eggs and chicken. 10 to 30%, and sometimes more. That's a big chunk of the woman's income. And development specialists will tell you when the woman's income is typically spent on the very important things, like taking care of a child when it's sick, paying school fees, paying for putting a tin roof on the house, and other emergencies. So let me I even like to use this little chart to give you a sense of the potential, because I think a lot of people see village chickens and they don't really see much potential. Well, let's say, look at the top is eggs laid per year for a hen, and down the left is the number of hens. So typically, your village chicken may lay 40 to 60 eggs a year. All right? A typical commercial chicken might raise 300 plus eggs a year, but in a commercial setting. But if you go down the left, if you walk into a typical village, they might have 7, 8 chickens, and maybe 2 of them are laying hens. And I'll come back to why there's so few, right? Well, there are so few. But with a little bit of intervention, it's not unreasonable to get up to 10 to 20 hens, and to get up to 70, 80, and 100 eggs a year per hen. And if you look down here on the right, what are we talking about? We're talking about a 13-fold increase in production. So go back to that woman's income. 10 to 30% of her income is from eggs and hens, and all of a sudden you increase that part of her income by 13-fold. That's not, it could be even greater if the person really gets in, really starts to get quite, talented at raising chickens and eggs. I can tell when I walk into a village I'll come to it in a minute, whether they're actually vaccinating based on the number of birds on the ground. All right, so I'll come back to that though. So let's talk about micronutrients. If you talk to the Helen Keller or Save the Children or these groups that work internationally on nutrition and malnutrition, what they'll tell you is what's really key for pregnant lactating women and children in the first 1,000 days is lack of micronutrients, iron, zinc, vitamins. And if you look at the chicken and eggs, they provide those. And not only that, you're talking about protein, the egg is considered the gold standard of protein by which all of the proteins are compared. So it's this ideal source of micronutrients, and it has all these other what I call practical features. One, it's easy to cook. You can keep it for a long time without refrigeration. An egg will keep if you keep it in a cool spot for a week or two. A boiled egg can keep for up to 3 weeks if you keep it in a cool spot. Maybe a week if you have it in your pocket. It's small size, so you can consume it. You're not going to slaughter a goat or a cow that often to feed it. So you don't have leftovers. It's also practical. A person can raise chickens without owning any land. You go to a village, they're running between the households, they're running along the road, they're running on the edge of ag fields. It's very low risk. If you ask people typically, how important are chickens? They usually will say not. And you go, why? Well, we don't spend anything on them. They just run around. And usually if you're not investing much, you don't think of it as that important. They're easy to raise, they have a short production cycle, they also have a very high feed conversion rate compared to most livestock. Women, children, disabled, people who have to be around the household can raise chickens because it's almost very, very little labor. And they free range in some settings. They're actually very important for pest control, and they also provide root manure. I'm not going to go through all this today. I do a whole other talk on what the problems are and how you solve them, but I'm going to briefly just kind of outline them for you. So the number one problem for raising chickens throughout the developing world is disease prevention. And the number one disease is Newcastle disease. And that's the same in Nicaragua as it is in West and East Africa, as it is in Nepal and Asia. There's one disease, Newcastle. This disease wipes out typically 80% of the chickens in a village when it comes through, and it comes through villages about once or twice a year. And so the other reason people say we don't value chickens much, and they don't even build coops, is you're not going to invest in chickens if they die once or twice a year. And literally, if they're going to die, well, we're not going to spend money on the coop. So that's the number one thing. I say to people, if you don't vaccinate for Newcastle, everything else is a waste of time. And I'm serious. So you don't build a coop, don't spend money on feed, don't spend much other effort on chickens, because if you don't vaccinate, you're going to lose your investment. And so Newcastle is critical. And then in addition to that, for village chicken, the probably other thing is deworming. In a commercial setting, you would vaccinate for quite a number of other things, but most village settings, all you have to do is vaccinate for Newcastle and deworm, and you're pretty much doing your health care. The vaccines, by the way, they come in a little jar, it's a little drop. You put a drop in the eye 3 times a year, and you're good. So a kid can do it. We teach them when we don't even have droppers that you pluck a feather from the bird, you dip it in the thing, and you wipe the eye. And so the problem with vaccines, though, is actually getting it out to farmers and getting the supply system working, which works sometimes and other times it breaks down. But the vaccine, there's good vaccines, but getting the farmers is sometimes difficult. And also getting people to routinely use them. Vaccines are often faked. People put water in a bottle, call it a vaccine, and then of course then it doesn't work, and the farmers get disillusioned and they stop vaccinating. And there's other problems with vaccines. Okay, there's issues with free ranging. Obviously, you're getting benefit from free ranging, they're feeding themselves, but at the same time, there's things like risk of predators, diseases going to the neighbors. When they free range, it means they're going to mix with the whole village. And that's why I use the term village chicken rather than household chicken. Because from a disease and a healthcare point of view, you need to look at the village as one flock. Because if any chickens get sick in that village, probably most chickens in that village are going to get sick. There's issues about securing affordable feed. Even with scavenging chicken, you typically want to supplement. If you supplement, it means figuring out what local feed is something people don't eat that you can supplement your chicks and your hens. And then another key limiting factor is chick survival. So that I won't get into it. There's a couple strategies for improving chick survival. And the last is actually teaching people about how to get a better price for their eggs. I've been in villages where on one side of the village, they're getting twice the price as on the other side of the village. It's just because the woman farmer was more savvy. All right, so kind of this is basically a response to everything I just described. I don't go through it, but basically the point is there's not a single intervention. You ought to really just doing vaccination on its own is not going to really improve poultry. But if you don't vaccinate, the rest of these things are a waste of time. But pretty much, you basically, it's about training. If you notice, most of this is not about purchasing much. It's not about investing much. Almost 90% of improving poultry is just about training. It's just about, in fact, you don't even need to give people, some people are like, oh, you got to give them a hen. No, you don't even have to give them a hen. Typically, they can actually, either borrow a hen and use it for one cycle, or they can actually, people can buy one. And frankly, if they're not willing to buy a single hen to get started, they're probably not going to do too well producing chickens. But you don't need to give animals, and within, 3 short months, they're going to have numerous birds. So they can go from having almost 0 to numerous, and in 18 months, they're going to have 20 laying hens if they do all these, improve their practices. All right, so again, each of these things kind of address what I was just talking about. You need to find affordable housing configurations, how to build housing for the chickens. A real key one is record keeping and management, disease prevention, biosecurity. Besides vaccinating, people need to understand how birds are infected, how to prevent disease. And you discover this among communities. Like that woman, one slide there was a woman who lives near the airport. She's a Maasai woman, so she lives in the Maasai area, which is mostly cattle keeping, near the Nairobi airport. She has no other farmers near her. But she learned one time she went and bought 4 hens at a market, brought them, and it killed all of her 200 birds. And so now she completely understands biosecurity, and she does not bring birds in from the outside, and she consistently, without vaccinating, maintains a healthy flock. But it's because she's in an isolated place. And she's figured it out over the years and completely gets not bringing in outside animals. All right, so I talked about training. So really to improve poultry is mostly about training on these practices. And coupled with training, you've got to find access to the vaccine for Newcastle. And then people have to apply the vaccine. But you need to connect people to the vaccine, where can they get it? And then you need to basically give it, otherwise, the husbandry practices to improve practice. Typically in Africa or elsewhere, we train trainers. In the case of Ghana, because there's so many languages, you train trainers in one language, they train trainers in another language, and then they finally train at the 3rd level down. You're training in northern Ghana 3 languages down. So this is in the Accra, Ghana, and this is a woman training women trainers who are in another language, who are then going to go out and train here. So this is northern Ghana in a language that's unique there, and the people from the capital of Ghana don't speak this language. So in this area where they're training the women farmers, there's not a building within miles, and so they basically train under a tree. This is the kind of thing they teach. They teach about egg management. Over here, they're vaccinating, showing Newcastle vaccination by plucking a feather. And here's how you count your eggs, so you decide which ones you're going to brood and which ones you're going to consume, and keep them in a cold bucket with a lid, with a cool bucket with sand. Another way you can train is through school. So this is, as I mentioned, kids raise chickens. It's not easy, not hard to do. If you go to most households in the developing world, kids are usually involved in it. So we actually wrote a course for 6th grade kids, and right now that's where my current study is. In Tanzania, we're teaching 6th grade kids in 10 primary schools, and Nepal 6. And we're basically trying to assess before and after, do they take the information home, and does poultry production improve at home if all you do is teach the 6th graders. The interesting thing about this was that we're also using kids to collect data, which is really cheap. The kids for homework go home, and in one night they come back and you have 470 data sets. And you're like, in one night, you're like, oh my goodness. I mean, I would pay a graduate student, $20,000 over a year to go out to those many households scattered over such a distance. But so that's another way to teach. All right. So I'm going to step back now and talk a minute about, okay, we got this project. We think we need to improve poultry. So when you design your intervention or how you go work in a community, what are some of the things you want to think about in your design? You might say, we're going to do this, this, and this. And then if you go back and look at principles about intervening, you might say, well, maybe that's not such a good way to do it. But here's a few of the principles. So you probably could list 20. But if you're going to work in a developing country and you're going to go work with a community, some of the things you want to think about is, one, whatever it is you're doing is going to be using local, accessible resources and technology. If they're in Dodoma, Tanzania, you can't expect them to be getting, day-old chicks very easy. Or you can't expect them to be getting maybe bagged feed for a commercial type feed for their birds. Or they can't get access to other materials that you need to raise chickens. Self-sufficiency. It's something that the local people can do on their own, and they don't require outside help, outside inputs. It's basically, which leads to the thing below, which is sustainability. Low risk. This is an often overlooked one. And I'm going to come to it in a minute, but one of the classic mistake in poultry production in the developing world, in this setting where I'm talking about, is people want to come in and go, oh, we should just bring an improved breed, get 300 birds, 300 eggs a year, and then you just need to confine them, but that's how we do it. And you need to feed them in a cage. Well, you actually just asked somebody who's got a few birds on the ground to go to a highly sophisticated system overnight, and it's also cost a lot of money. They're going to have to build a coop. They're going to have to buy all the feed, and they have to have well-balanced feed because they're going to be now responsible for providing all the nutrients to those birds. That's not low risk. Sustainable, it kind of relates to all these others, is, you can look at a number of issues and you might ask, is this sustainable? Are we giving a lot of, inputs, or are we subsidizing something, or is the community, for some reason there's some problem that it's not a really good way to go for them? Self-interest. Really, all these things I've mentioned kind of relate to one another. But self-interest is, if it's not in the self-interest of the people you're working with, it's not going to be sustainable. It's not going to continue once you leave or once your project's over. And so initially people might think, well, we don't really care about chicken. Well, I say, well, let's see if if you're involved in vaccinating and you see that chickens trickle, then maybe you're interested in at that point. But in the end, it has to be in their self-interest. It's going to stop as soon as the project's over. And the last one here, and again, I said you could probably make a list of 10 other what I would consider principles. But the last one here, before I get to One Health, is knowledge before new technology. And so again, let's use the idea of a commercial versus a village chicken. And they understand the scavenging system, but if you all of a sudden are going to commercial, folks don't initially, I would say, have the skill set or the knowledge to evaluate, is that what I should do? They can't crunch the business model, like how much my feed costs, my outputs of eggs, and how I'm going to sell those additional eggs. And I mean, if they don't fully grasp vaccines, because they're probably going to have to be vaccinated for 3 things now if they go to a commercial bird. So you're basically asked them to take on a new technology that they don't fully understand. And so what I would say, you basically want to make sure people have the knowledge first before you introduce any kind of new technology. And the last one we'll come back to, but this is typically not on a list in development studies, One Health, but we're going to get it there. We're going to come back to this slide a little later. All right, just to give you a sense of this, what I would call, sustainable, or how you might look at 2 options and make a choice in development. Let's compare a scavenging system, which is ubiquitous around the world, as I described, versus an improved breed and a confined system. And this might just be, the idea is you're going to have 30 birds, but they're improved breed, they're going to build a cage for them, and then they're going to have to feed them, and they're going to keep them confined. Well, let's look at kind of related principles on the left. Accessible resources. Well, village chickens are locally available, they depend on less inputs, there's small investment, it's demonstrated to be sustainable just by the fact that it exists everywhere. And self-interest, well, they'll say initially maybe not. And they understand that system is understood because it's been around a long time. Versus on the other side, you have outside inputs required, it's high investment, so it's risky. I will say, based on track record, it's not likely to be sustainable. And it's usually not in the people's self-interest. If it's not sustainable, it's a waste of money, so they shouldn't do it, despite the fact some outside folks might have convinced them that's what they should do. Let's look at the bird characteristics. I'm talking about local African birds or local birds in Nepal. They have characteristics versus a commercial bird. Disease resistance. Typically, the local bird has more natural resistance. All right? Predator avoidance. A local bird will know to run when a hawk flies overhead. A commercial bird will stare up at it and just look at it, okay, and go, hey, what's that? So they have a sense to run and hide. Brooding skills. Well, commercial birds typically very often won't have any brooding skills left anymore. They're not going to be very good at raising their own eggs. So if you're in a system where, in terms of being self-reliable, and they're going to be relying on the hens to actually raise to brood the eggs and brood the chicks, local birds are going to do a better job of it. Feed requirements. Again, it's inexpensive. You're doing a little bit of supplemental feeding, but for the most part, they're going out and getting their own feed. And labor requirements, low versus high. All right. I'll stop this for a second so you guys have a question, and then we'll go into this kind of case study in Nepal. Anything struck you guys? Yes.
I just had a question about, in terms, I know you said you don't need any land to raise these chickens, but space is
you don't need to own the land.
Right. But so space is limited in some of these dense village settings. If you're increasing the number of birds, do you find that the land will just naturally limit it, or are there any negative impacts ecologically from increasing these scavenging birds?
Well, you have to assess the available forage. It depends on what environment you're in and how much forage there is, like how much table waste there is, how much garbage is laying around, how much livestock has manure around, it has lots of things to eat in it. So at a certain point, you're going to basically, as the number of your hens or birds go up, you're going to have to start supplemental feeding more. So the percent of supplemental feeding will go, but at the same time, you will be having success, and you will be having a higher number of eggs to sell, and you'll be able to afford more supplemental feeding. So yes, with time, you'll have to increase supplemental feeding. With numbers, yes.
I know some cultures keep other species of birds like pheasants or ducks, but are they just not as high production as chickens? Is that
No, I'm not saying that. I'm focused on chickens. But ducks are very important. In a lot of these settings we're in, there's both ducks and chickens. Quail. In Nepal, they harvest pigeons. They put baskets under the eaves of their house, or they build little pigeon houses, and they basically just harvest them and eat them, so they're eating pigeons. Yeah, all those other species are good. In West Africa, in the more arid areas, it's a lot of guinea fowl. So like in that northern Ghana, we were actually talking about guinea fowl in that training as much as we were about the chickens. Yes?
I was wondering what the demand is like. Back on the slide where you showed how a woman would be able to give these returns by 13-fold.
Yeah.
Do you have an economic model for how many women can do that with a market saturated?
You must have taken an ag econ or something. If you were an ag economist, that's the first question they asked. The good news is the market is incredibly strong right now, and most of all these places I've talked about, that the price for local chicken and local eggs is much higher than for commercial. And in fact, if we get to the point where that market is flooded with local birds, the people are going to be doing a lot better in the rural area. I don't know at what point that happens. It is an economic analysis, but I think it's a long ways off because there's a huge demand for local birds, and they cannot meet that insatiable demand. So prices will drop, yes, but at that point, people are actually, if they got to that point, probably a little better at raising things and getting more efficient. And also, probably transport becomes a little better. Maybe women farmers get together and cooperative transport. So other things can occur as well. Prices will come down. But I'll be surprised if anytime in the near future pork prices go south, because they're just so strong for eggs and the chickens in the developing world. I'm going to go on. One more question. We'll go on. Yes.
What risk do you see to carnivores that might be lured into the village setting? What risk do you see to the carnivores that might be lured into the village setting by an increase in poultry?
Everything. I mean, weasels. What animals come into?
No,
That's
just,
is that what your question?
yeah, do you see an increase in bushmeat hunting or any of these other things in some of these villages where you do?
Oh, well, actually, the reason for poultry was just the opposite. We got started in this because near Ruaha National Park in Tanzania was people's allowed bushmeat. And we were thinking, well, what can people eat besides bushmeat? Because I worked on wildlife before 2006. And we said, well, chicken. And so that's how we kind of actually got into chicken. It was not that it lures wildlife into the thing. It was almost the opposite. They have something to eat besides wildlife. I mean, the wildlife, I don't think the chickens really, they lure in things like small predators, which most people aren't eating the small predators. They don't lure in the kinds of animals they're going to eat, like gazelles or whatever. So. All right, let me describe this situation a little bit. So in Nepal, there's this major project called the Suhar Project. It's a USAID-funded program. The lead contractor is Save the Children. Subcontractor is Helen Keller International. And the goal of the project is to improve child health and nutrition. They have a 47% stunting rate among children in Nepal due to malnutrition. So it's very, very high. It's actually higher than Tanzania, which is maybe about 40%. And so that's the focus. So that seems like a pretty narrow focus, right? Well, in a minute you're going to see how actually you really need a One Health approach to do this well. All right, so these are the components of the program. They provide nutrition education for mothers and community workers. They promote clean water and sanitation in the communities. They improve health and nutrition community services, and they're promoting homestead vegetables and chicken production. And these are the high nutrient vegetables like dark leafy greens and orange fleshy potatoes, and now poultry. Now this is a fairly recent thing, I'd say in the last 5-6 years, that poultry has become part of this. Not just here, but in the international nutrition world, is that people said, well, what's the best source of these micronutrients? And the best source is some animal-based source. And they say, well, then of the poor people, what's the most likely source or animal they have access to? Well, if they don't live near the ocean or a lake, it's poultry and eggs. It's probably the most affordable thing. So I would say when they first got together, the folks working on this are over on the far left of this here. They're basically the child and women health groups, and then kind of interacting with nutrition groups, putting together this plan, this project. As the design was that really they're focused on, how do we get their health up, and then, but what component is, we're also going to do training and promote people to raise chickens at the household. Early on in the program, people on the far right, animal health, animal production, I don't think were really involved in the design. So what are some of the things that when you get into this project, you start realizing you need to wrestle with? Well, one, and what issues do they affect? One, it affects health. It affects mother and child health. It's nutrition. Malnutrition is both a combination of disease, impacting your gut, and inadequate diet. So now you're getting into disease and frankly, human medicine. It involves agriculture, production of high nutrient vegetables, also animal agriculture, production of chickens and eggs. And then if you get into chickens, animals, then you're going to have to deal with animal diseases. And you're not going to be successful with chickens unless you get into chicken diseases. And then if you have chickens, now this is probably the last, number 6 here is not something I've ever been asked by an agricultural person. So it's only in recent years I've been working side by side with the international nutrition groups, and when I work with ag groups, we've done our job if we've increased chicken production, we've increased egg production, and people, as far as we know, are consuming more. But the question I got asked as soon as I teamed up with the human health and nutrition groups, they go, well, if there's more chickens in the yard, there's more manure, and the kids are going to get in it, aren't you going to have more bacterial infections among the children? And nobody studied this. All right, so this is the first question I got. I went to a meeting, my first meeting on this in Nepal. I got asked that by the health nutrition person from USAID, from Save the Children, and Helen Keller, and I had to say we don't know. And so they want to figure that out. But you might hypothesize, though, for example, chickens, they eat ticks and other vectors. So you might hypothesize in households with chickens actually have less vector-borne disease. but they actually have higher bacterial infections. We don't know. But so you can see these issues, it really requires a very holistic look at the project because all of these things have to be tackled and need to be looked at. So I think, for example, Helen Keller, we have a proposal then to start maybe doing a study of what is the impact of having higher numbers of chickens around in the village. For example, might be no impact on disease, on bacteria, because there's so much other animals around. If you have a backdrop of cattle, of goats, existing chickens, a few more chickens may have negligible additional impact, but we don't know. So, take us back to that chart. I would say in the early part of designing these projects, I think a really key principle was it put together kind of thinking through with a One Health approach. Did you think about the animal disease issues as well as the human disease issues? Because you're going to be raising animals. Did you think about how are you going to feed the animals? Does that mean you have to take food that you would people would eat? How does that work? So it really means you have to take on a very holistic approach to any of these projects, as I said in the beginning. But part of that holistic approach is it really needs to be, in these kinds of projects, it has to be really a One Health approach. You need to, right from the start, be thinking along these lines. The other thing I'll point out is I co-wrote an article with nutrition folks this last summer, 3 international nutrition folks, and I didn't even know the jargon. I don't think I've ever put anything in I don't even read those journals. And I realized we had a completely different set of jargon. It's that the community over here on the right is not even on the same journals. They're not in the same terminology. For example, homestead production, that's not a term we use in ag side. That came from the nutrition side. That's what they called it from the beginning. So, but it's just in terms of a common terminology. But there is this gap, and I think over time, getting people in all these disciplines to work together is really going to eliminate that gap. I think more multidisciplinary publishing of articles and analyses will come together. But it was really striking for me when I got animal production people in the room and nutrition and health people. They were really in a different vocabulary. The first 5 questions they would ask would be completely different of the challenges, and they're really in different places. But once we get them together for a while, they all start recognizing, oh, there's a whole set of things our side hasn't really looked at. So, again, One Health, just to kind of summarize, is that it's actually really critical I would say go back to poultry and One Health, is that poultry, I would say, is the ultimate One Health example. That poultry affects people's livelihoods, it affects their health, it affects their ability to provide appropriate nutrition for their family. And there's a number of studies showing that actually poultry is the first step out of poverty for some very poor people. You basically, as I described, you can get a hen, it's pretty easy to get a single bird. And if you get the husbandry right, you can grow that up to having 20, 30, 40, 50, 60 birds, 100 birds. And with that, you can buy a goat, and you actually can start a company. And I'm citing an example. We did, in one of those 6th grade classes we taught, one of the fathers came in Tanzania, and he'd never raised chickens before. He sat in on it. He didn't have chickens. He lived 100 yards from the little rural school. He went home. He started raising chickens based on what he learned in the primary school class. And he now has 200 birds consistently, and his egg sales subsidized his SIM card business. He started a SIM card business based on egg sales. So that's possible, and it can help you start forward. So going back to the principles, what I would just say, besides these principles and maybe another 10, one that needs to be in development principles is One Health, when you're involving humans and animals and environment. That's my talk. See if you have any questions. Yes?
Without coops, have you run into the problem of people finding that their hens are being lost or stolen?
Yes. Without coops, the birds get taken by predators, and then they also, in areas where people are desperate, they get stolen. And so typically, in an African village, they actually bring the chickens into their house at night, right into the hut or the house, and they close the door. So the chickens are in there where the people are sleeping at night. That's okay if you have 5, 6, 7 birds, but it's not going to be okay if you actually start vaccinating for Newcastle and you have 20 to 100 birds. But as soon as you start vaccinating, you realize you're making a lot more money, you can afford to build a coop. and then people do. So there's what I call almost a progression of intervention. The first thing is vaccinate Newcastle. Then all of a sudden, in a short period of time, they have more birds, and then they're willing to build a coop. So they build a coop, and then you can get into egg management, chick management, hen management, and then you're on your way. And supplemental feeding, all that. Yes.
On the spectrum of having within a community one or two families that really dedicate themselves to having poultry, maybe selling a lot of eggs or selling a lot of live birds, versus having every family have their own, and their own source of eggs and their own meat. Where do you recommend that being in a spectrum, or how does the village decide we're all going to have our own, or we're all going to buy from a certain person? Because I guess I see if every family has their own, then you wouldn't have any families making money by selling. You wouldn't have that.
Well, you're not selling usually in your rural community. Most of the sales all typically go to a local town or to a big city. Sometimes, they'll typically have a guy come by on a motorbike once a day. And he said, like in Tanzania, if you're within 100 kilometers of Dar es Salaam, a guy's on a motorbike and he's going to come by and buy your eggs every day. And he's heading to Dar es Salaam because the prices are high there. And the same thing with chickens. They have trucks come by every day along the main highway, and they're basically buying, anybody sitting by the road with chickens like you saw in that basket, they're basically buying all those, and they're going to be in Dar es Salaam in the afternoon, and they'll be selling those chickens for the highest price. So I'm focused on, again, village chicken, because I'm focused on very poor people. And so what you will find, though, let's say you go to a village and there's 20 women farmers, and you've done this, there's some training going on, they figure out how to vaccinate, and all of a sudden those 20 farmers have gone from each having 5 chickens, each having 30, 40, 50 chickens. What you typically will find is a couple of farmers, say maybe it's 20%, will actually get really good. And they'll go up to 200, 300, or 400 chickens, and they actually become a small commercial producer. Now that's a person who, to me, might consider going to commercial production. They might even get an improved breed. Because if they can get up to 200 birds, maintain 200 birds consistently, then they know what they're doing. They know biosecurity, they're obviously routinely vaccinating, they know about supplemental feeding, they have figured all that out. At that point, it might make a lot of sense for them to go to confinement, and then to bring an improved breed, and they're off. But I think, so then they just might become a commercial producer, and they're going to obviously probably go to a different market. They're going to sell at a little higher volume and go to a different market when they sell. But what I think is almost life-changing is you can get the typical rural person to go from having 5 chickens to having 50 chickens. It's life-changing. This isn't the end all. This is not their economic answer for the world, but it actually is substantial economically for them if you can go from that few birds to maybe even just 20. If you can go from, say, having 2 hens to 20 hens, it's huge. Yes.
This sounds to me like a mix, question, but vaccines, are they produced so that they have to be kept cold, the Newcastle ones?
Good question. There is one thermal stable vaccine. It was produced by an Australian development group about 20 years ago. It's called the I2 vaccine. And they struggled for many years to develop a thermal stable vaccine, and they did. It's stable for about 30 days. It's okay at room temperature. What they did is they went around and trained the national veterinary labs in countries, and they wanted to be a free access. They didn't go through a private sector. That's good and bad. So, as I mentioned, it's a good vaccine. Most countries like Kenya, Tanzania produce it, but it's not market driven. So what happens is all of a sudden you do a project and they run out. Or this last year in Tanzania, I'm in the middle of my project and we're ready for the vaccine. At the highest level in the lab, the national lab, they faked the vaccine and there's a huge scandal and we're selling water. And so, it's horrible, right? But that's the kind of thing that can happen with a vaccine, and that's what happened in Tanzania last year. So we're now importing a vaccine from India to vaccinate birds in Tanzania, and it's a little more complicated. But and now you go to Nepal, they were trained to produce the I2 vaccine about 10 years ago. They produced it in the lab briefly, and then they never produced it for distribution. So you have this huge Suhara project, millions being spent on chickens and this and that, and that's where I go and I go, you guys, USA, these are all going to die. Your top priority needs to get a Newcastle vaccine out to these farmers. And so I've been working on that with them for the last year and a half. to get a vaccine. But the question is, yes, there is a thermostable. There's still work being done to try and make a better thermostable vaccine. To follow up to that, though, if you don't have a thermostable vaccine, you're going to spend over half of all your work on development training and maintaining the cold chain, which is what we had to do in eastern Nepal. We basically had to train from the small town, the little vet suppliers. They didn't have refrigerators. And in Nepal, the power's out 18 hours a day anyways. So if you have a refrigerator, you got to teach them how to keep the door closed all day in order to keep it cool. You got to put little cool boxes on the back of motorcycles going out with the community animal health workers that go out to the farmers, and then when they get it, they need to use it that day. So all that training, as you can imagine, logistically is very difficult. So it's really key to get a thermostable vaccine.
How much are the vaccines?
They're pennies. The cost is the bottle and the distribution. So it's like, it comes out to like 2 pennies. I mean, cost of an egg the income from an egg will vaccinate your birds, all your birds for a year. Yes?
So I eat eggs all the time.
Yes.
But I was thinking back on the worst case of food poisoning I ever had, which was from a hard-boiled egg in Guatemala, and then just this morning, ProMed put out a notice about a bad food poisoning in kids in Guatemala from eating chicken and eggs. And so back to the cold chain issue, where on that continuum of training do you then also start talking about the human health implications of consuming poultry, keeping poultry flocks, avian influenza, salmonella, all of those things that obviously in the big picture we're talking about delivering a much higher form of nutrition to a great large group of people, which is by itself, of course, worthy, but then there are these other consequences of living closely with birds, eating birds, especially in places where there is no refrigeration and often inadequate resources for properly cooking food and cleaning food and that kind of thing.
And that applies to anything in the developing world. I mean, any food you eat. Most people know that's why they take birds to market live. That's why it's live bird markets. If you want to do something for animal welfare, get refrigeration throughout the world. But no, I mean, the birds go to market alive, they go home alive, and they usually don't eat the bird. They usually eat the bird the night they kill it. So in terms of the bird being fresh, we do train. We have a module on how to clean a bird and avoid disease. And we did that when we were doing all the bird flu work. So in Africa, we did training on preventing bird flu. It just so happens that the same practice to prevent getting bird flu of a bird you might eat applies to preventing other salmonella and all other kinds of infections. It's mainly about avoiding the intestinal tract, dipping in hot water after you're done, and all this kind of thing. So it's possible to clean a bird and I think dramatically reduce exposure, and we do have a module of that. We teach people that. So it's but people kind of understand a lot of this. I mean, that's why they keep them fresh. They typically don't store them long. But if you're cautious, I mean, like you put eggs in a cool place, you can keep them for a week. Yes.
Okay, so I'm a farmer in Tanzania.
Yeah.
My business is working very well, and I get this money. And I never had this amount of money in my hands.
Yeah.
In my country, people who get crazy and start buying things unnecessary, and they don't know how to manage this money. I'm not asking you if your NGO, your work helps those guys to manage this money, but are you working in collaboration with an NGO that does that with them?
They're not making that much money. I mean,
they would buy alcohol in my situation, and they would.
No. Okay, let me just take a spin on your issue. This is an issue. If you talk to social scientists, I've talked to everybody on this. So the social scientists would say, okay, chicken income is typically the woman's income. So now you've tripled production, and now the woman's making more than the guy who's out in the field farming. So you don't think he's going to take over the chicken production, and she'll have no income? That's exactly the query they'll pose to me. Yeah, that can happen. I mean, but there's still a net increase in production at the household level. But at some level, you don't say, well, we're not going to let the woman make more income because the husband might spend it. And the answer is yes. The husband might more likely spend it on drinking or something else. But that's a social issue. I mean, if you turn around, imagine coming to California, you're teaching a farmer how to grow chickens, and the dad decides he's going to take over it rather than the woman, and you're going to go tell him, no, you wouldn't do that. I mean, you just reverse the setting. So, any other questions? Yes?
Do you think that poultry production in Nicaragua would have its own unique challenges compared to Tanzania or Nepal? And so, what should those challenges be that we would have to address?
They're pretty similar. I mean, I hate to say how similar they are around the world. What you want to find out is how people where they sell their eggs, where they sell their chickens, and kind of get a sense of where the markets are. What prices is the community getting? Like, are they getting ripped off, by the middlemen? And then what are the primary limiting factors? They're Newcastle disease, they're probably parasites, and maybe a lack of adequate supplemental feed. Those probably, which is just about the same everywhere. You might find a disease is more common. For example, you might find fowl pox. One of the things when you teach vaccinate for Newcastle, because the birds die young, they don't get a lot of diseases, other diseases. So as soon as you vaccinate for Newcastle, the birds live longer and other diseases show up more often. So for example, fowl pox will show up. And then the farmers will say, hey, well, you vaccinated, it didn't work now, and you put it in the eye, and that's where they get the fowl pox. Your vaccine caused fowl pox. I'm literally, that's what people say, and so they want you to stop vaccinating. Your chickens, your vaccine's giving my birds fowl pox. In the training, you have to tell people exactly what is a vaccine. Some people think it's medicine. It's an end-all, it's supposed to take care of everything. They have to understand that, and they also have to expect other diseases. But none of the other diseases are as devastating as Newcastle. Newcastle is nothing even close to it. So, and then just as an aside, it just so happens that Newcastle and avian flu have the identical symptoms. So one of the arguments for doing work on poultry in developing countries, like say on the border with India of Nepal, is you want everybody to vaccinate for Newcastle, so avian flu comes in, which does routinely, you will see it, because when the birds die off, you have a vaccinated or sentinel flocks, and you'll go, oh, birds are dying off, but these are vaccinated birds from Newcastle, it must be, you'd be more suspicious that it's actually avian flu. But if your birds are typically dying anyways, you wouldn't notice bird flu coming in. And that's one of the ways we got funded to do this work, is actually also training people to be sentinel villages. Yes?
I'd just be curious as to what data you're having the children collect and how reliable you think it is, and like what kind of questions you're having them answer.
We're having the kids collect 20 questions, I think, and then we have a grad student go in and collect 50 questions. But the first 20 are identical to the kids' questions. So we're actually double checking it. We're collecting data two ways. We're collecting data with the kids through homework, before and after again. And then we're collecting it to a grad student who's literally going to a random sample of the households and interviewing the parents and getting the same data, plus a bunch more data. And then we're going to compare those two sets of data. I actually suspect the kids' data might even be better. I mean, they have a single homework assignment. They go home one night, they collect the data, come back. The grad student's going out to 150 households. By the 50th household, he's tired of collecting data. I don't know. You have to worry. This guy's out riding a motorcycle house to house. And I don't know. It could be just as good, but we'll see. But we're collecting two sets of data in order to compare to see if it's good data. If it's good data, wow, what a way to save money collecting data. On certain types of questions. Obviously, you couldn't ask personal questions, but things like, how many eggs did your hens produce this week? And how many did your family eat? How many did they sell? How many chickens died last week? And that kind of thing. Those are questions that a sixth grade kid can ask. Yes?
In say a village setting, when you talk about biosecurity, what really are you doing in that biosecurity interventions in that setting?
Biosecurity in a village is very tough. But the number one thing is people take their chickens and they go to a local market, maybe it's 5 kilometers away on Sunday, and they sell their birds. And let's say they take 5 birds and they sell 4. Live bird markets are totally full of every chicken disease you can imagine. I mean, basically just infested with it. And so they're just sitting there among all these sick birds all day long. What do people do when the birds are sick? You sell them. So, and then but they only sell 4, they bring the one back that night, they basically infect the whole village. So the number one biosecurity thing you do is you actually, as a village level, and it has to work at the village level, if one household doesn't do it and the rest do it, you're still going to get an infected village. So you basically teach the village to create a quarantine coop on the edge of the village, and you say, look, if you ever have to, and we strongly encourage you to sell that last chicken cheap and get rid of it and don't bring it back, that you have to quarantine. And the same goes if you decide to go purchase any other young chickens or to increase your flock, they need to be quarantined. But the number one thing is the role of live bird markets. When I was with Carol Cardona, used to be vet extension here, and we were working together. She'd do a pathology class for veterinarians in Uganda and elsewhere, and basically we'd go to the local live bird market. This is a true story. Live bird market in Kampala, Uganda, and we'd say, "Do you have any sick birds?" And the guy, "Oh, no, these aren't sick birds. These are all fine." No, we want sick birds. We're doing, and he goes, "Oh, they're all sick." That's exactly what the guy said, and he was right. So, and it's great for pathology because you bring it in and you see everything. I mean, they were cutting the birds up the rest of the day, the class, and we saw just about everything you imagine in birds. So, but that's the number one problem. One other quick story. So I was going to meet with USAID agricultural person in Tanzania. I'm supposed to go brief them. Apparently, they sent him a note. He said, "Well, I don't think I can squeeze it in." And then someone says, "Oh, this Dave is a poultry guy. Oh, have him over. I'll have him over for dinner." Apparently, at his house, he had chickens and they all died. And he wanted to pick my brain, like, what did he do wrong? Well, it was very obvious what he did wrong. He basically went and bought his birds at a live bird market, and brought 8 birds home, and in 2 weeks they're all going to be dead. All righty. Anything else? We're done.